Hi, I welcome you all to this video of YouTube where we will discuss about the first aid. In this video, we will discuss about first aid which can be applied in any organization. Although the channel is for hospitality and hotel management, but first aid, as you know, is for a social cause. So if you understand what is first aid and if you become a first aider, you can apply it anywhere in the society, at your home or at the organization wherever you are working, or even if you are traveling on the way. If you find someone who is in need, where by helping them you can save life of a person, it is really a great pleasure to do such kind of things. Hence, let us continue discussing in this video about the first aid. Flow of discussion. For today's discussion, in this video, we will have definition of first aid, importance of first aid, 3 P's of first aid, principles of first aid, where we'll discuss about the do's and don'ts of first aid box, contents of first aid box, and symbols of first aid being used by various organizations. This video will follow one more video on first aid where we will separately discuss about various situation handling which arises due to accident incidents and which should be known to a first aider as what should be done in case of those situations. So for situation handling, we will have a separate YouTube video. So let us proceed, and first let us understand what is first aid. The initial assistance or treatment that is given to a casualty for any injury or sudden illness before the arrival of an ambulance, doctor, or other qualified person is called first aid. Or first aid can also be defined. First aid is the first and immediate assistance given to any person suffering from either a minor or serious illness or injury to preserve life and or prevent the condition from worsening or to promote recovery. It includes initial intervention in a serious condition prior to professional medical help being available, such as performing cardiopulmonary resuscitation, which is popularly called as CPR, or other methods of artificial respiration while waiting for an ambulance. This cardiopulmonary resuscitation, that is CPR, is very famous and a practice which is utilized while giving many first aid to various injured persons or the casualties. So CPR is of a great help to a first aider. Importance of first aid. First aid training is an important learning for all the age groups. So there is no age bar. Very few people show interest in such areas, as most of us think This is to be learned only by people who are connected with the medical field. But it is not true. We all should know first aid, learn about first aid, and get first aid training so that we can handle any situation which arises without any warnings or alarms. Lives need to be saved at the critical time, so a helping hand at such times is very crucial. If you can become a first aider, you can save lives. Is it not great? It is really a great pleasure, a matter of great satisfaction, and it is for the humankind. So we all should try to help person, and saving life is really something amazing that a person can do if the situation arises. Every single minute during the emergency situation is important. So if you become a first aider, if you learn first aid, if you get training in first aid, you can save life. That is really, really a great thing to do on this earth. In this slide, we'll discuss about the three P's of first aid. The three P's are the primary goals of first aid. They are number one, preserve life. Number two, prevent further injury. And number three, promote recovery. These goals might seem overly simple, but they are simple on purpose. When someone is injured, it's all too easy to panic and forget what you need to do to provide assistance. The three P's remind you of the very basics. Do what you can to save the person's life. Do what you can to keep them from sustaining further injuries, and do what you can to help them heal. So these are the three primary goals of any first aider. Now we will proceed to next slide, where we'll discuss about the principles of first aid. And under this particular subtopic, principles of first aid, we will discuss about do's and don'ts of first aid. So first two slides of principles of first aid will discuss about the do's in first aid, and then next two slides will discuss about the do nots of first aid. The first aider or the first aid provider must act calmly and logically, be in control both of himself, herself, and the problem, be gentle but firm, and speak to the casualty kindly but purposefully. Build up trust by talking to the casualty throughout the examination and while giving the aid. Explain the casualty what he or she should do. The slide continues on do's of the principles of first aid. Never leave the casualty alone, but continue to talk to him or her until the ambulance or doctor arrives. Continuously reassure the casualty. Never never separate a child from their parent or guardian. Send the casualty to a hospital or doctor by the quickest mean of transport. Always inform the police about the serious accidents. Inform the relatives of the casualty. So these are the do's of the principles of first aid. And now we will discuss about do not or the don'ts of the first aid. Certain things to avoid in first aid are listed as follows. Do not touch a wound with your finger or any instrument. Do not put an unclear dressing or cloth over a wound. Do not allow bleeding to go unchecked. Do not allow a crowd to gather around the casualty. Do not move a patient unnecessarily. Do not take off clothing unnecessarily. And the slide continues about the don'ts or the do nots of the first aid. Do not allow the patient with a fracture or suspected fracture to be moved until splints have been applied. Do not fail to give artificial respiration when needed. Do not fail to remove false teeth, tobacco, or any other edibles from the mouth of an unconscious person if he or she is having any of these. Do not leave a tourniquet on for over 20 minutes before loosening it. What is tourniquet? Tourniquet is a device that is used to apply pressure to a limb in order to limit but not stop the flow of blood. Do not forget to send for a physician. So, with this, we have discussed about the principles of first aid, and now let us understand about first aid box. A first aid box containing medical supplies for emergency use is usually kept in all the departments of any organization and many other places, even in bus, train, aeroplanes, or any other mode of transport and various other places. A minimum variety of certain types of supplies should be ensured in the first aid box at all times. Number of items and types of items in first aid box may differ from place to place or as per the location. We will discuss about the contents of the first aid box in our next slide. So it is very evident and clear from this sentence that all the first aid box may not have all the materials in the same quantity. Even the size of first aid box differs. It can even be a small, it can be a medium, or even be a large one, or even of any other size which is suitable for use at the location. It depends on the traffic of the area, or it depends on the purpose for which you are keeping this first aid box there. Hence, there's no fixed size which should always be used. At the same time, there's no fixed item which should always be there in fixed quantity in the first aid box. So, the first aid box are tailor-made as per the requirement. However, all the first aid box usually have few items. So in our next slide, we will discuss about the contents of the first aid box from which there can be many items in many first aid box. The size of the first aid box again differs from organization to organization. That can again be a tailor-made box. So for example, a housekeeping department in a hotel can have a box which will be of 17.5 inches into 10 inches into 6.5 inches, which should be a dirt proof box. So you can design the first aid box as per the requirement. We'll proceed further to our next slide where we'll discuss about the content of first aid box Again, I am repeating, these are the contents to give you an idea about the contents of the first aid box. This is not the exhaustive list. At the same time, this is not only the list from which the item for the first aid box should be selected. All the first aid box may not have all these contents. So in this way, we are just trying to discuss about the general contents of the first aid box. However, you are free to decide in consultation with the practitioner or the doctor what should be the content, and you can also decide it as per the location where you are going to place this first aid box. The first aid box should contain the following items: a first aid book, antiseptic cream useful for cuts and bruises. Bruises is actually blood or bleeding under the skin due to trauma of any kind, typically black and blue blood at first, but color changes as the healing progresses. Savlon or Dettol antiseptic solution. Here it is just an indicative of, say, it can be 2 bottles, but it depends. Calamine lotion, a medicated liquid containing zinc carbonate. This has a soothing effect on painful sunburn. It can also relieve itching caused by minor insect bites and stings. So we are continuing with the contents of the first aid box. 5. Pain relief spray, which gives instant relief in back pain, joint pain, muscular pain, sprains, and sports injuries. Number 6. Chloromycin eye ointment, 2 tubes. Again, it is just indicative. This can be used in case of bacterial infections of the eye. Soframycin skin ointment is the 7th item that we are discussing. Again, it is indicative, 2 tubes. It can be 1 tube, depends even on the size of the tube. This is used in bacterial infection of the skin and in burns too. Number 8. Oil of cloves for an aching tooth. This is used to provide temporary relief to the toothache. We are continuing with the contents of the first aid box. Number 9. Clinical thermometer, which can be used either orally or under the arm. It should be cleaned with antiseptic after each use, even for the same patient. Sterilized dressing packets for use on fingers, so of smaller size. Sterilized dressing packets for use on hands and feet, so this should be sterilized of the medium size, and the sterilized dressing packet for use on other parts, this is larger in size. Sterilized cotton wool packets can be used to pad a dressing or to clean an injury with soap and hot water. We'll continue with this slide and of content of first aid box, and the 14th item is crepe bandage packets, which may be needed to bandage a sprained or stained joint such as wrist or knee. Number 15. Large adhesive plaster can be used on minor wounds or to secure a dressing. Number 16. Adhesive dressing strips for small cuts and wounds. Number 17. Roller bandages. Various sizes can be used to secure dressing, to apply pressure to control bleeding, and to give support to sprain or stains. So roller bandages are of various sizes according to the requirement. You can have some quantity of almost all the sizes if possible. We'll continue with the content of first aid box, and 18th item is eye pad for placing on the eye in case of an eye injury. Number 19 is tweezer to remove splinters from the skin. Number 20, dressing scissors to use when cutting away dressing or bandages. Number 21, safety pins packet to be used for fixing bandages or slings in place. And number 22, pad and pencil for writing. We'll continue with the content of first aid box, but the slide that we are going to view now, it is not compulsory to have the contents of this slide in all the first aid box. Reason being, many first aiders and many medical practitioners believe that tablet should not be kept in first aid box. However, this is at the discretion of the management who is deciding on the first aid box. That is the reason red background has been given here to discuss these four contents of the first aid box. So in some first aid box, these tablets may be there. If it is not allowed to keep tablet, which should not be given by a first aider if it is decided by the management or if it is the policy of the organization, then you can avoid keeping tablets. However, if you want to keep tablets, if you have to keep tablets in the first aid box, these are the indicative tablets. Again, these are not the exhaustive list. These are just indicative. So we'll discuss here just about 4 different tablets. 23rd, antacid tablets, which gives relief from mild indigestion and heartburn, a burning sensation caused by stomach acid, or irritating the gullet. So if you have irritation in the gullet, in that case antacid, and there are various other situations when we can use antacid tablet. Anti-diarrhea tablets, these are used to relieve diarrhea by slowing down the bowel movements. Paracetamol, used for relieving pain and lowering a high temperature. Aspirin, used for relieving pain and lowering a high temperature. It is used, or it should be used, with restrictions, as it may irritate the stomach lining. So we have to be careful if we are using aspirin, if you are giving aspirin to the casualty. With this, we discussed about the contents of first aid box, and now in this slide we will discuss about first aid procedure. The most important technique to know in first aid is administrating cardiopulmonary resuscitation, that is CPR, and other methods of artificial respiration. CPR is given to a person whose respiration is ceased. In case only breathing had stopped, the technique for chest compression to simulate cardiac function can be left out, and only artificial respiration is to be concentrated on. And if we are giving artificial respiration, we should know A, B, and C of artificial respiration. So let us discuss about A, B, C of artificial respiration in first aid. A for airways. So you should always remember as a first aider to clear airways. B for breathing. So you should also always restore breathing after ensuring that the airway is clear. And C for circulation. We should restore circulation. So first we should ensure that there is no blockage in the airway or the passage of the air. Then we should ensure that the person is breathing, and then we should ensure that the circulation is proper. However, if catastrophic bleeding or the massive external bleeding occurs, then it should be arrested first before following the ABC of first aid. Reason is, if the bleeding is massive and all the blood is drained out from the body, the life will not be there. Hence, we should arrest the bleeding first if the bleeding is massive. So you can also see in the figures here, in the pictures here, on the top left corner and the first image on the right hand side, that is the top one, you can see a person performing CPR, whereas in right side lowest image you can find a person giving mouth to mouth respiration to a casualty, which is one of the form of artificial respiration. So with this, we will move to our next slide for discussion, and the next slide reflects various symbols of first aid which is used by different organizations. There are many other organizations using many other symbols. So these are just an indicative that first aid does not mean you should have only a plus like this in red color, or in any particular first aid symbol which you have seen, you should not think that is the only first aid symbol. So first aid symbol differs from organization to organization. Now, with this, we have come to an end of this particular discussion on first aid. Hope there would have been some learning or some refreshment of what we have learned earlier, like a refresher training. And I pray Almighty it should be of some help to you and also to the mankind on this globe. With this, I'll take leave from all of you from this YouTube video where we discussed about first aid. I also would like to inform that we will also discuss about various situations in next video where the situations will be related to first aid. So we'll have another YouTube video where we'll discuss about various situations of first aid. With that note, I would like to finally tell hi and bye to all of you. Bye bye. Take care.